Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about 3 signs that we commonly see in different cases of nasal mass. And these are the Dodd sign, double density sign, and Furstenberg sign. We'll talk about what kind of a sign is it. Is it a clinical or a radiological sign? Where do we see these signs? And why do we see it? And why is it called so? You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our first sign, which is the Dodd sign. Now, what is Dodd sign? First of all, this is a radiological sign that we see on an X-ray of the nasopharynx on a lateral view. So here is our image. Let's look at the first image over here. This is an X-ray of the nasopharynx on a lateral view. Now, what is Dodd sign? Dodd sign is this crescent of air that we see between a nasopharyngeal mass and the posterior pharyngeal wall. Now let's look at the image over here. If you see the arrow pointing towards a crescent mass. Now I'm going to fill up this region. This is the crescent air column that we are seeing, which is in between the nasopharyngeal mass and the posterior pharyngeal wall. This crescent of air shadow that you are seeing over here is what is known as the Dodd sign. And Dodd sign has another name, and that is Crescent sign, as you can see, because it looks like a crescent shaped air shadow. Now this is seen typically in a case of antrochoanal polyp. Now, what is the reason behind this? Now, in a case of lateral X-ray of the nasopharynx, when there is a mass present in the nasopharynx, if this mass has not arisen from the posterior wall, in that case, we will see a thin air space remaining just behind the mass and before the posterior pharyngeal wall, and that area, that air space that remains, is what is forming the crescent shaped radiolucent area. A positive Dodd sign means that the nasopharyngeal mass is separate from the posterior wall. So in a case of antrochoanal polyp, which originates from the antrum of the maxillary sinus and it reaches the choana and it hangs freely in the choana. So a antrochoanal polyp will go and grow in this direction, and it starts to hang freely in the choana. Now because it has not originated from the posterior wall, we will see a crescent air shadow between the mass and the posterior wall. And this sign was named after Dodd, who was the one who described this air crescent appearance behind an antrochoanal polyp on a lateral radiograph. Now, what is the importance of this Dodd sign? The Dodd sign actually helps us in differentiating between two conditions. It helps us in differentiating between antrochoanal polyp as well as a case of juvenile nasopharyngeal angiofibroma. Now, antrochoanal polyp, we saw that there is the positive Dodd sign, whereas in JNA, we see a negative Dodd sign because the JNA actually arises from the posterior nasopharyngeal wall. And what it does is, because it's arising in the posterior nasopharyngeal wall, it's filling up the airspace completely, and so we do not see any airspace left behind. So the Dodd sign can be used to differentiate between a case of nasopharyngeal angiofibroma and an antrochoanal polyp. Now, the reason I've added this second image over here is there's a common confusion regarding this image. You'll see the second image with this marked red arrow. You'll find a lot of this image in the internet, and it will be showing that this is the Dodd sign or the crescent sign pointing towards this region, because you may actually end up imagining a crescent air column right over here. But this is actually not the correct demonstration of Dodd sign. Let's look at the first image here and remember that this is the area that we want to see, and this is the crescent air shadow that we are looking for, not the one that we are seeing in this part. So that's about Dodd sign. Moving on to our second sign, which is double density sign. Now, double density sign, as you can see, this is a radiological sign that we see in a case of CT scan of the paranasal sinuses. What are we seeing here? Let's see this image in this portion. We are seeing a hyperdense area within an opacified sinus on a CT scan of paranasal sinuses, where the hyperdense, meaning these bright parts that you're seeing, hyperdense parts are actually indicating the presence of fungal debris or fungal mucin. And this is contrasting with all these hypodense region. The hypodense region is the surrounding inflamed part of the mucosa. And this is a typical sign that we see in a case of allergic fungal rhinosinusitis. So double density sign, where we are seeing a heterogeneous shadow over here. There is a hyperdensity as well as hypodensity. This is indicative of allergic fungal rhinosinusitis. Now let's try to understand why this happens. Now normally any sinus secretions or mucosa, they will appear as a grayish soft tissue density. The double density that we are seeing over here is because of manganese as well as calcium deposits which occur in this allergic fungal mucin. And this is what is responsible for creating this hyperdensity, intense bright shadows that we are seeing within the sinus in a non-contrast CT scan. The reason why this is called double density is because the sinus is showing two different attenuation levels. We have the hypodense soft tissue density in the sinus, and then we have the hyperdense fungal mucin concretions, which is happening because of manganese and calcium deposits. This is seen in case of allergic fungal rhinosinusitis. Now, a few MCQ questions regards to this is, the most common sinus which is involved in allergic fungal rhinosinusitis is the maxillary sinus. And this hyperdensity that we are seeing in sinus is not always blood or a tumor. In chronic rhinosinusitis, when we are seeing this is indicative of fungal etiology. And in this case of allergic fungal rhinosinusitis should be differentiated from a case of invasive fungal sinusitis. How will we do that? As the term suggests, in invasive fungal sinusitis, the disease is very invasive. So it ends up in causing a lot of bone destruction. An invasive fungal sinusitis will be seen in immunocompromised patient, whereas allergic fungal rhinosinusitis is seen in immunocompetent patients. So this is a little bit about the double density sign that we see in allergic fungal rhinosinusitis. Lastly, we'll talk about the Furstenberg sign. Now, what is Furstenberg sign? This is a clinical sign which we elicit during the time of examination of a nasal mass. Now, what is this sign? The expansion of a nasal mass on crying, straining, or compression of the jugular vein is the Furstenberg sign. And this is seen in case of encephalocele, meningocele, and meningoencephalocele. Now, what happens here? In an encephalocele, there are intracranial contents which are herniating through the skull base, and it enters into the nasal cavity. So the mass that you're seeing in the nasal cavity actually contains intracranial content. And this nasal mass that you're seeing, when the infant is crying, or you are doing some kind of straining or doing the Valsalva maneuver, what happens is that it leads to the jugular vein compression, leading to intracranial venous pressure increase. Now, because there is increased intracranial venous pressure, this raises the CSF pressure as well, leading to expansion of the encephalocele. This is the mechanism behind the Furstenberg sign happening. And this was named after Furstenberg, who was the one who described this characteristic expansile pulsation of the encephaloceles with raised intracranial pressure maneuvers. So Furstenberg sign is a typical sign you'll be seeing in case of encephalocele, meningocele, and meningoencephalocele. And there's another MCQ that you should know about in terms of congenital midline nasal mass. We have the glioma, and then we have the encephalocele. A very common question that is asked over here is to differentiate between these two causes of congenital midline nasal mass. How will we differentiate them? So coming to glioma is actually a firm swelling whereas encephalocele is a more soft swelling because of the intracranial contents. Glioma is actually non-compressible, whereas encephalocele is compressible. Glioma will have a negative Furstenberg sign, whereas encephalocele will have a positive Furstenberg sign. Glioma will not transilluminate, whereas encephalocele will transilluminate. So these are the four differences that you can use clinically to differentiate between two congenital midline nasal mass, which is glioma and encephalocele. So that's all for today. I'll see you in my next class. Thank you.